I'm Martin Sasada. I'm the consultant anaesthetist at me. I've now personally treated tens of thousands of patients under general anesthesia and an even greater number under sedation. My topic for today is the relative safety profiles of general anesthesia and sedation for facelift surgery. I think it's true to say that general anesthesia nowadays is very safe, provided that the following criteria are met. Firstly, that surgery takes place in a properly equipped facility, ideally one with intensive care facilities in the unlikely event of a serious complication. Secondly, that the person giving the anaesthetic is appropriately trained and qualified with fully trained support staff in attendance. And thirdly, that an appropriate anaesthetic technique and equipment are used. That having been said, there's no doubt in my mind that sedation is inherently safer than general anaesthesia for the following reasons. Firstly, the patient retains control of their own airway and breathing throughout the procedure. This is important because the most serious problems associated with general anesthesia are related to the management of the airway in an unconscious patient. Secondly, fewer drugs are normally used during a procedure under sedation, and this obviously reduces the likelihood of an allergic reaction. Thirdly, the risk of anaesthetic equipment failure is reduced with treatment under sedation. On a personal note, I would say that I have not given a GA for a facelift for about the last 5 years, despite working almost daily with Phil Guest, who's now one of the UK's busiest facelift surgeons. There are, of course, a number of other important factors involved in deciding whether to choose general anaesthesia or sedation for your facelift, and I plan to cover these in subsequent videos.